Member for Vernon-Monashee.
Thank you, Honourable Speaker. I want to speak in favour of the motion presented by member from the North Vancouver Seymour. Be it resolved that this House supports this government's work to train, recruit and retain more healthcare professionals to relieve the pressures on British Columbia's healthcare system and increase access to healthcare services. I admire the member for her over 3 decades of service in our healthcare system and for her continued efforts to support government's work to strengthen our healthcare system. And I want to start my remarks by saying that health science is real and it matters. And the healthcare workers who believe in health science, they are very important, and so is the vulnerable patients. So that's why our government will continue to work that we're doing. And some of the work that is done by BC-NDP government includes creating more seats at the post-secondary institutions for various healthcare professions and opening of the second medical school at SFU, as well as recruiting more than 3,900 healthcare workers and more 39,000 healthcare workers and more family doctors. The longitudinal family practice payment model was developed by the Ministry of Health in consultation with BC family doctors and doctors of BC. 4,000 family physicians have registered, expanding the number of family physicians working in longitudinal primary care. December 2023, there were approximately 5,000 family physicians working in the longitudinal family primary care, which is an increase of 708 from December 2022. This has recruited more than 230 new family doctors and 230 nurse practitioners, highest number we province ever seen for nurse practitioners as well, who are now working in the long-term primary care model, benefiting more than 243,000 patients. Last month, I was excited to join our Premier and Health Minister in Vernon, where we announced much-awaited and much-needed expansion of mental health psychiatric unit at the Vernon Jubilee Hospital, which will help us to attract, hire and retain psychiatrists and mental health professionals by providing them the facility where they will help to deliver excellent care for the patients. We also visited newly opened 90 long-term care beds, which helped to attract great staff, and I got to see firsthand during my visit at the Creekside Landing along with our Premier and Health Minister. Our government also funded the new primary care network in Vernon by supporting Shuswap North Okanagan Division of Family Practice to make primary care more accessible. This PCN is already helping many people like 77-year-old Lila and her friend from Vernon-Monashee, who sent me a beautiful message. I quote, "Thank you, well done for accurate information. I was put on a wait list with primary care clinic, was given a name via IHA social worker and met with the nurse practitioner who is now my medical person, all this in December. The thrill of a lifetime is given my friend's same name. She called and got taken in right away. I used walk-ins for several years, brought my records, and my new doc was delighted. I support the NDP with much gratitude," end quote. Mr. Speaker, when leader of the opposition was health minister, he promised 159 primary care networks and he delivered 0. Many of us from healthcare sector have seen his deep cuts, massive layoffs of thousands of healthcare workers, wage rollbacks of thousands of healthcare workers. We now see the impacts of decade-and-a-half underfunding and mismanagement of the system. When it comes to supporting people and services they rely on, our BC-NDP government does not cut corners, or we do not compromise healthcare or other vital services by unacceptable cost-saving measures which leave detrimental consequences in the long run. Now we're investing in people, and still some members of the opposition call them criticizing the public sector jobs. Those are the public sector jobs providing the exceptional care and services. Our government invested $750 million initiative to support nurses, to establish the support nurse fund and additional $100 million for career laddering opportunity. We're the first and only jurisdiction in BC who are doing the nurse-patient ratios, and we have health human resource strategy which focuses on retention, recruitment, training, and to retain more staff. I want to share a quote from Canadian Federation of Nurses President Linda Silas. I quote, "Now nurse-patient ratios. I've waited 20 years to see a government like the British Columbia government to say It's my responsibility, I as government, to ensure patients receive proper care and nurses have safe workload to do that proper care. That is only true, which your government is committing over $750 million in 3-year plan with BCNU at the table. As I have said, I waited more than 20 years to see that, end quote. Thank you.
Thank you very much, Member.